Fun fact, did you know the more times you press the call button, the less likely someone is going to want to come in here and help you?
Bet you know that from experience.
I've just had a couple of disgruntled roommates in the past who were just like you. Can't seem to handle me for more than a few seconds.
I'm surprised you're not banned from this place already.
Oh no, the staff here love me. I do my therapy, take my meds, and eat without complaints. Ask anyone and they'll probably tell you I'm the best little angel they've ever had to deal with.
Funny how that doesn't seem to translate over to the rest of your day-to-day life.
I don't know. I don't cause problems for anyone who doesn't give me a hard time. So long as I get to do what I need to do, we're good.
I failed to see how blowing up the front door to our base and putting us both in the hospital is something you needed to do. Were you just feeling that getting a beat down from us wasn't enough?
You know, I tried to keep things polite by knocking, but I didn't get any answer this time. I spent a good 30 minutes out there just waiting for any of you to open up. I actually started to get worried. So consider this a wellness check.
Well, here's your answer. Do you think I woke up today looking like this?
Given your line of work, I wouldn't be surprised.
God, I am so fucking done with your shit. Where is the nurse?
This floor is packed to capacity, if you couldn't already tell. So I'm afraid we're stuck together in this room until we're discharged.
They can send me to a different floor if they have to. I'm not dealing with you 24/7 for 2 weeks.
You've got to have something else wrong with you first. Maybe a couple more injuries and I can send you over to the ICU. You get a whole room to yourself there.
How about I send you to the ICU by showing you the bill for us both that you are so graciously going to pay for once I get my lawyer to...
Fuck yeah, let's go. It's not Carl this time.
Seriously, can you not? You're gonna blow out my eardrums.
God, I did not want to see that fucker today. So glad it's you. When are your shifts for this week? Man, and that's 12 hours, right? Shoot. No worries though. I'll make sure we're both on our best behaviors anytime you're here. Go get yourself a coffee once you're done. Oh, and don't bother paying for lunch. I'll set you up for the next 2 weeks. Get some for your mom too. It's on me.
How often do you come here that you know the nurses personally?
Count how many times you've sent me here, and then some more for a couple of other heroes, and one really bad migraine.
Oh, yes. Sorry to bother, but would it be possible to switch rooms? My roommate and I don't really get along. And it's to the point that we might end up sending the other to a different floor at this rate. Oh, no. Security won't be necessary right now. We're good for the moment. Sure. I'd be willing to ask if anyone wants to switch with me. When's the best time? I don't want to disturb anyone.
Breakfast, lunch, and dinner, obviously. What do you think we're all doing for the rest of the day? Sitting around watching boring old news that's severely lacking in coverage of us right now? The physical therapist better see you doing your steps and improving, otherwise you're paying for all the extra days your insurance isn't covering.
Maybe he forgot who's paying out of pocket for the both of us. See, this is why we can't be together. Is there anyone here who's easy to talk to?
Oh, yes. There's a really nice frequent flyer I saw when we were coming in. Sweetest guy you'll ever talk to. Loves telling old war stories and life on his ranch. If you need anyone keeping you up for those late-night blood draws, he's great for that.
You know, I asked the nurse, not you. I'd rather get a professional's opinion instead of yours.
Believe me, as a frequent flyer myself, I am more than qualified to tell you about the patients here. And if I don't know them, I will by the end. Always great to know what parts of the city not to target.
I'm surprised you're not targeting anyone you don't like.
Oh no, I'll do whatever I can to avoid breaking their legs if I can keep them from coming back here. Some people are just more of a threat to my patients when they're not healthy.
Honestly, you're not far behind in that regard.
I'll make sure to avoid ending up with any meaningful injuries the next time I send you back here.
Assuming you'll be able to do it intentionally.
Anything and everything I do is intentional. In fact, I don't think I'd want to be anywhere other than here if it means getting to see my favorite nurse.
Have you tried an invitation to have a coffee instead?
Of course not. Conflict of interest with patients and all that. But unfortunately, we seem to keep missing each other on the street. One day, though. Oh, yes, of course, of course. Please, don't let either of us keep you from doing what you need to do.
Oh, yeah, that's me. No, thanks. I don't need any medication. I can handle pain pretty well because of, well, you know.
Note: patient non-compliant with medication. Educated on the importance of pain management for upcoming rehabilitation activities.
Oh my god, shut up. It's optional. Do you see this? This is the kind of stuff I have to deal with on a daily basis.
Oh, our nurse already knows all the juicy details. We talk about all of my endeavors every time I'm here.
No wonder you're being avoided on the street.
Conveniently missing each other.
Whatever helps you sleep at night. Yes, I'm good for now. I'll let you know if anything changes.
As soon as we start physical therapy. Calling it now. Oh yes, of course, sweetheart. I can verify the name is correct, and my birthday is January 21st, 1996, same as last time. The pain is always there. I should probably tell you that I regularly take painkillers because of a certain naughty individual who may or may not be in this room right now. I'd only like to bring up the concern that taking too much would be detrimental to my health. You remember what the doctor said last time? So, I'm wondering if, in your expert opinion, a more holistic approach would be a better alternative. Massages, I hear, do wonders for these kinds of aches. Around my shoulders, the sides of my hips, all the way down to...
Note, patient acting inappropriate to nurse, reported to security, requesting car to take over for the remainder of the patient's stay.
You know, he might just make for a good anti-hero. Once you get to know him, you'll understand why he's so disliked for both sides.
At this point, I think I'll take my chances with him instead of you.
Be my guest. You could probably use more enemies to spice up your collection.
And when exactly is he supposed to show up?
Probably on the night shift before he's had his coffee. Right when he's at peak insufferableness.
Can't be any worse than what I'm dealing with right now.
Oh, but you'll start feeling a different kind of pain even earlier than that once you start your physical therapy today. All the consequences of your past actions will come to haunt you. Should have taken that painkiller so you won't be at the mercy of your kneecaps.
How rich of you to be so concerned, despite the fact that your past actions are the very reason we're both here in the first place.
It's all in the job description. I make life more difficult for you, and you try to compensate with simple solutions.
Isn't it you break things and I fix them?
Bestie, we both break things. There's no other way of looking at it.
I'll break your kneecaps if you keep talking.
And give me the opportunity to spend more time with my favorite nurse while you so graciously foot the bill on my behalf once I countersue you in court? Yes, please.
Maybe doing enough damage to send you to another floor isn't such a bad idea right now.
Spoken like a true hero. If it weren't for patient privacy guidelines, I bet the press would have a field day with your blatant disregard for the well-being of others.
I'm sure they'd understand that context matters in this particular situation, given it's my job to keep you from causing trouble.
Who's causing trouble for who? Our nurse is thrilled with my compliance. Isn't that right? Of course. I'd be delighted to start my physical therapy as soon as possible. I'll do my best to get better.
Somehow I highly doubt that, given how you're no less insufferable from the moment you walk in here to the moment you leave.
I'll probably be the only one walking out of here by the end if you start slacking off on your therapy. Better get a move on.
Gladly. How?
Look at that impressive pain tolerance. The internal screaming is barely noticeable.
I'm perfectly fine.
I don't know if our nurse will agree with that. Your lack of compliance might just set you back an extra week. Oh, what could I possibly do during that time while you're still out of commission?
Do something productive and prep for that date you seem so intent on. Good for you and my sanity.
What an excellent idea! You're quite considerate when you want to be. Pat yourself on the back and take part in some self-care, like not depriving yourself of pain relief.
Care more about yourself and I'll do the same for me.
I've got to care for your well-being. If you're not up to par once we're out of here, I won't have as much fun doing this all over again.
For once, I hope your date goes well, so you can have other priorities in your life.
Oh, don't worry, my friend. I can always make time for both of you.